Talked to her since then. I talked to her a few weeks ago, and those state cuts have already cost her additional $600 out of pocket to pay for her prescription drug coverage. When I was in Trenton, again in Northwest Missouri, we're talking about how rural hospitals are really being hurt by the failure to expand Medicaid and by Medicaid cuts. And somebody told me that the maternity wing of Grundy County Memorial Hospital had been closed. And so now everybody in the area was going to Kansas City to give birth. And they said, and this kind of haunts me, they said there's never going to be another baby born in Grundy County. And things like that's important. And so the Democratic Party has a plan. It's called Healthy Missouri. And we're here to talk about that as proactive steps we can take to increase options and to reduce costs for healthcare. Now, we understand that the healthcare landscape, and we understand the political landscape right now, is that the Republicans control Jefferson City and control Washington, D.C. And the only policy that the Republican Party right now is supporting and pushing are cuts to healthcare. And these cuts decrease access and they increase costs, right? We have a track record of these cuts. Here in the state of Missouri, on July 1st, they cut the Missouri RX program, and 60,000 low-income seniors in Missouri lost prescription drug assistance. Over 1,000 low-income seniors in Cape County lost prescription drug assistance on July 1st. That's a state policy, and that already happened. They're in the process of cutting 8,000 low-income seniors and people with disabilities off Medicaid for in-home assistance. 8,000, that's currently happening. The Republican legislature refused to cover 260,000 Missourians by expanding Medicaid. In Washington, D.C., they're trying to gut coverage for millions of people. They're trying to remove protections that guarantee that people who have been sick before have access to health care. And the entire time, the Democratic Party has been opposed to these health care cuts. All right, we've been fighting these cuts every step of the way, and we're continuing to be opposed to these cuts. But what we're here today is saying that the Democratic Party, while we're against the Republican cuts and we're going to continue to fight the Republican cuts, we also have some things that we're for. We have some positive, proactive things we can do to improve the healthcare system in Missouri and provide more options and lower costs to Missourians. So that's what this Healthy Missouri plan is about. The first thing that we're doing is we're renewing our call for Medicaid expansion. This is something that we've been doing for years. It would add coverage for 260,000 Missourians. Estimates show that it would create up to 24,000 healthcare jobs in the state of Missouri.